Good morning and welcome to Veterans Heartbeat on the Pulse of the Veteran, where we discuss issues of health, happiness, opportunity, and well-being of interest to the veteran community, their families, and the community who honors them.
Good morning and welcome to another episode of Veterans Heartbeat, brought to you by River, the Rural Institute for Veterans Education and Research. My name is Jason Zencraft. My co-host Ed Lisofsky is here with me, and he is the Executive Director of River. We welcome you to a weekly wide-ranging discussion of issues, events, opportunities, and needs in our veteran community. Morning, Ed. How you doing?
Morning, Jason.
We'd also like to thank our sponsor, Farside Signs. They create amazing-looking vehicle graphics that will drive traffic to your business. They are located at 1526 South Avenue West in Missoula. Follow them on the web, Instagram, and Facebook, or just stop on by.
Ready, Nick? Jason, you ready?
Mm-hmm.
Oh, by the way, on the radio, we have Jason with us, too, okay?
Great. Hi, Jason.
Hey, how you doing, Doc? Uh-oh.
Good.
Is this mic damaged?
Take that.
Okay, here we go. Sorry, my mic was broken.
Jason does that. Okay, everything is pre-recorded. If you don't want to answer something and you don't like what we did, just tell us, okay?
Sure.
All right. So this morning, we're real excited. We got Dr. Cruz from Kentuckiana Integrative Medicine out of Indiana. And he's been doing some real exciting things, and everybody's talking about the opiate crisis, on how the opiates are not being able to be prescribed for veterans and everybody. And Dr. Cruz you're an emergency room physician?
Yes, I'm board certified in emergency medicine, and then I did that for about 12 years. Then I did 2 years of anesthesia residency, and my plans were to do anesthesia finish that residency, and then do a fellowship in pain. But I decided that I could do more good by shifting gears into integrative medicine, which is basically combining the best of natural medicine with the best of conventional medicine. And so now I do pain management, but I do it with natural therapy injections, and we do a lot of different things in our office. We help cancer patients tolerate their chemo better and help their immune system work better with high doses of IV vitamin C. We do IV ozone, which is oxygen with a third atom. And some people think ozone is pollution, but ozone actually protects the earth from the sun's ultraviolet light. And when you give it to a patient, it helps their immune system fight whatever's attacking them. So I do hormone replacement, stem cell therapy injections for torn ligaments and arthritic joints. And I also treat addiction and depression, severe anxiety, suicidal thoughts, OCD, PTSD. And those issues we treat primarily with ketamine. And, almost all antidepressants, which are used for all those conditions, typically take a month or two to work, and they have a lot of side effects. Particularly troublesome side effects for folks is the sexual side effects of SSRIs. And just waiting while you're feeling extremely depressed for this medication to kick in.
You're talking about the traditional.
Correct.
The stuff that the
Prozac,
veterans... Yeah.
And there's a role for antidepressants, don't get me wrong. They help a lot of people, but they are slow to work, and the class of antidepressants that Prozac is in and Paxil have a high incidence of sexual dysfunction side effects. And again, all of them take a good 1 to 2 months to work, if they work. The success of antidepressants, last I read, was about 60% or worse. And ketamine, even in somebody who's severely suicidal, will usually work in 1 or 2 treatments. And we usually give them 6 in a 2-week time span. And it's amazing. People, who've been depressed since they're 10 years old and now they're in their 40s, really blossom and can start functioning. I have one patient who has been depressed since she was 10, and she started cutting her arms when she was like 13 and has overdosed 4 times, a lot of social phobia issues, not engaged socially, basically a homebody, not going to college. She struggled a great deal to finish high school. And after ketamine, she was able to get a part-time job for the first time. She's 24 now, and she's going to college part-time. Her parents are thrilled. She's one of the few patients that comes back to us for ketamine boosters about every 2 to 3 months. The majority of patients who do the series of 6 are able to not need a booster for 6, 9, or 12 months or never. And we like to equip our patients with certain self-help books that are very powerful. I mean, ketamine is a fantastic medication to get you out of your deep hole or deep depression, but the folks need to develop other coping skills and other ways of thinking, and that's where these books come in. They come. You can get them in a standard book form or audio. A lot of people, when they're depressed, they can't concentrate and don't want to read, but they're willing to listen to an audio. And then we recommend certain supplements that have a long history of helping with the nervous system, like L-tryptophan, L-theanine are really good for anxiety and have very few side effects. And, we've used ketamine primarily for mental health issues, like I've said, OCD, PTSD, severe depression, severe anxiety, but we've also used it in folks with addiction issues, but that's not as prevalent in terms of patients who want ketamine to get off of opiates. But it can be done. You just, you use the ketamine to help them stop using the opiate, and then you switch them to either Suboxone or naltrexone.
So we have a lot of chronic pain patients,
right,
that we deal with. Mm-hmm. And ketamine, from what I'm reading, is the next generation of treatment for the chronic pain patient. Now, one of the problems with the opiates is as you increase the dosage to compensate for it becoming the norm for the patient and not working, the more you increase, the less it works. Is that correct?
Definitely. Patients can become insensitive to a narcotic that they're on for a long time, which is why you need a pain specialist in many cases who's accustomed to rotating to different narcotics so that the body isn't used to that narcotic, and then you can still control the patient's pain. And there comes a point where it's very difficult because the patient's body has gotten so accustomed to all the different narcotics available, and there's not that many choices. And then, they can get into a very difficult situation because what's being given to them isn't controlling their pain, and whoever's prescribing it doesn't feel comfortable going higher because, there's a lot of pressure on any doctor prescribing narcotics. The DEA is monitoring him, the insurance companies are monitoring, and if you don't stay within a certain norm, even though it may be appropriate for the patient, you catch a lot of grief.
The Mission Act that just got signed by Trump for veterans says that if a veteran comes in for treatment, and I don't know what the numbers mean, but it was like 90. I remember that number, is all they're allowed for the month. 90 milligrams or something like that.
Probably 90 tablets. That's a regimen of 3 pills a day, and that's going to hold, I'm guessing that'll satisfy maybe 60% of the chronic pain population. but that's inadequate. I mean, hopefully you'll interview a pain specialist, but I think they'll tell you that will not control a lot of people's pain. And so what you guys are talking about using ketamine is a great idea. The tricky part about ketamine is that at the doses that we use for emotional problems, that will help somebody with chronic pain maybe 30 to 40% of the time. And the ideal thing is to get their pain under control so they can wean off of narcotics and then put them on something that's less problematic, like tramadol or gabapentin, which can effectively control a lot of pain situations without having the side effects of the opiates. Now, tramadol and gabapentin or Neurontin do have side effects. They are sedating. You know, you shouldn't operate machinery and take those medications. But in my view, they're safer than the narcotics. And, you know, you can also, not too many people have gotten into this. Like, I've used ketamine for what's called complex regional pain syndrome. And those are patients who, through a simple sprained ankle or a broken bone, injure a nerve. And they develop severe pain that even narcotics doesn't control very well. Those people, when you treat them with ketamine, you have to, you know, put them on a monitor, oxygen, cardiac monitor, pulse oximetry, and you're giving them very high doses of ketamine and monitoring all their vital signs for about 4 hours. And you do that, like, you know, 4 days in a row or 2 days one week, 2 days the next. And ketamine has the power to reset their nervous system and dramatically reduce or even eliminate their pain completely. I had one lady who was homebound with this type of pain syndrome, and for 7 years, and we treated her, and on her birthday, she was able to go dancing with her husband for the first time in 7 years. So it's very powerful, and again, that's a specific pain syndrome called complex regional pain syndrome. There's an area in between where folks who have chronic pain but haven't reached the level of a chronic pain syndrome could benefit from medium-high doses of ketamine. And I think it's a worthwhile endeavor because, you know, the opiates are killing people. And as safe as ketamine is, though, you know, you can abuse anything that's good. And too much ketamine can fry your brain if you're, you know, if you're an addict who's getting ketamine like from veterinary offices, because ketamine's used as an anesthetic not just in humans but in animals. Well, if you're using a lot of ketamine over and over again, you know, you could hurt your brain. And you may have heard of Special K. That's a street name for ketamine. But I think judiciously used, it has great potential for controlling pain without having harmful side effects. And the profile of ketamine is certainly a lot safer than narcotics. And it's so safe that you probably remember, I don't know how old you are, but you've watched enough movies, medics in Vietnam would give a soldier who was injured morphine. And morphine is a narcotic, and it does a good job of controlling a soldier's pain, but it also takes away their respiratory drive and lowers their blood pressure and their heart rate. Well, you know, it's great to control their pain, but all those other things are not good for a bleeding soldier. Now the military lets their medics give soldiers who've been shot ketamine, and the soldier can get 50 milligrams of ketamine every 30 minutes as long as his eyes aren't going back and forth, with what's called nystagmus. So the military is allowing medics to give ketamine every 30 minutes until the guy's pain is under control, as long as he's with it enough that he can communicate and that his eyes aren't twitching back and forth. And that is, I think, some significant evidence as to how safe it is. Ketamine is the only anesthetic that has the ability to support your vital signs at these doses, not at high doses. At high doses, it'll take away your respiratory drive. But at 50 milligrams every 30 minutes, it has the ability to control somebody's pain who's been shot, and it supports their breathing, supports their blood pressure, and supports their heart rate. And at the same time, it affects their memory a little bit, so the trauma that they're going through isn't nearly as bad. And partially the mechanism of that is why it works with PTSD patients. What I'm getting at in a convoluted way or long-winded way is that ketamine is very effective, not just for mental health issues, but for pain. The question that nobody has answered is, is it safe for somebody to use ketamine, at 50 milligrams every day to control their pain? I don't know what the answer to that is, but I certainly think that it's worth experimenting with because the profile seems a lot safer than narcotics. Does that make sense?
Total sense. We see a lot of patients that have pinched nerves in the back. How is ketamine going to help that?
That's trickier. I mean, every patient's going to be a little bit different, but it depends what kind of a pinched nerve situation they have. So if it's a herniated disc, or a bulging disc, well, it depends. A lot of those folks get better with an epidural steroid injection. Those don't always work. That's what I got to do a lot of during my anesthesia days, and I was disappointed with how effective or not effective those were. A good result with epidural steroids, you usually do like 3 every 2 weeks, and then you see how the patient's going to do. Sometimes people do 1 a month. It depends on who your pain doctor is. But if you've got a really big disc that's bulging and pressing on a nerve or herniated, you can do epidural steroid injections, and they'll generally be helpful, but they don't hold for that long. Like 3 to 6 months is a really good result with that. The other thing that I don't think the VA does for their military patients enough of is traction. And there's a lot of herniated discs and bulging discs that would improve with 30-minute sessions of traction where they put weights on your legs and they put you in a contraption that allows your legs to be pulled and your upper body to stay fixed, and that stretches and makes more space between your vertebrae. And they can also do this to your neck, although it's not quite as effective in the neck. But that can give the nerve more space and gives a lot of people relief. It's just that you have to go, and lay on the table for 30 minutes for 30 sessions. And a friend of mine who's a chiropractor is saying that very few insurance companies will pay for that therapy, even though it would allow patients to avoid surgery, which, there's a lot of modalities that can help a pain patient with pinched nerves that are underutilized and unexplored in conventional medicine, like lasers are very helpful. Warm water therapy, swimming in a swimming pool with an instructor leading the exercise class in water that's 85, 90 degrees is extremely therapeutic for people with pinched nerves. So, but anyway, nerves that are large and impinged upon by a disc, you have to be more aggressive, like the things that I've outlined. Smaller pinched nerves and muscles benefit a lot from what's called trigger point injections. And you inject the muscle in the neck with lidocaine, which is a numbing agent, like Novocaine at the dentist's office. And that lets the muscle relax, and it stops squeezing the nerve so much, because it's the squeezing of that nerve that makes it keep firing and shooting pain from your neck up into your head or from your neck up into your shoulder.
And right now, ketamine is not, this is off-label. It's kind of like
Well, it is off-label, but physicians have the right to use medications off-label as long as they believe that the benefits outweigh the risks. And there is so much research on ketamine. You can also buy a book called the Ketamine Diaries, which is accumulation of all the research that's been done on it. And the research is outstanding and substantial. You know, the reason ketamine isn't being, pushed more is that Big Pharma isn't going to make a lot of money with ketamine because there's no patent on it now. So what they're doing is reformulating ketamine in such a way that the part that makes you goofy or quote-unquote high can be eliminated, and then the therapeutic part be preserved. And they say that there's one pharmaceutical company that's about a year away from marketing a ketamine-like medication for depression. But I'm neglecting to tell you that ketamine for, acute suicidal symptoms is extremely effective. And I've used it, I've probably given now 300 doses for folks with not just depression, but suicidal thoughts. And you can break that cycle in one or two treatments. And it's like how when your computer acts up and you hit Control-Alt-Delete and you reset your computer, you're kind of doing that with your brain with ketamine. And it's amazing because, the person comes in and they're severely distraught. They're, thinking about the most, just the most destructive thing ever is, ending your own life. And they take ketamine and somehow the veil is lifted and they're still depressed. One isn't going to do it, but they're no longer, I need to kill myself. And it's a great thing because it buys the patient the time they need to get into the counseling that they need and to get on an antidepressant or whatever approach they're going to take. But that is now, if I had to guess, being used at 1% of emergency departments. When I was in the emergency department, we always used Haldol, which is an antipsychotic, and/or Valium or Ativan, and those two are very powerful, extremely sedating, and Haldol can have significant side effects. It's very effective to get somebody under control acutely, but ketamine is much more effective and fewer side effects, and so you're supporting the patient's vital signs, and so more and more emergency physicians who are reading about it are starting to try ketamine in those situations.
To our listeners, you've been doing this for a while, and it's been very safe and effective, right?
I have had, I think, out of probably 200 people, 2 or 4 treatment failures, and they all told me that the treatment wasn't going to work every time they got it. So if you go into something saying it's not going to work, you're going to, be a self-fulfilling prophecy. I would like to tell your listeners that they should, if they're struggling with depression or anxiety or, what I call stinking thinking, they should get the book How to Stop Worrying and Start Living by Dale Carnegie and Stress-Free for Good by Dr. Luskin. Those are 2 books that I read every year. And nobody teaches us as kids the power of self-talk and the power of speech to keep yourself, in a healthy frame of mind. And I encourage all of you to read those books because they'll help you with your therapy that you're doing for all the patients and VA vets. As we talked before, VA soldiers don't always get the care that they deserve. They've made the ultimate sacrifice so you and I can be talking on the radio, and we need to be more supportive of our vets. So.
Well, that's the time we've got this morning. And, Doc, I really appreciate it. We are going to be looking into this. I think we're going to have Dr. Ibsen on next week. and he's going to follow up with his plans on doing ketamine for the veterans.
Awesome. Well, if you talk to him, tell him he's welcome to call me whenever he wants.
All right. Thank you, Doc.
Thank you.
If you're interested in reading more about Dr. Cruz and his treatment with ketamine, go ahead to regnmedky.com to learn more.
So thank you very much for listening to Veterans Heartbeat. We'd not be able to bring it to you without all the support of the listeners. And thank you again to Farside Signs for sponsoring the show. If you do need a unique vehicle design, swing on by and check them out. Also, thank you to our main sponsor, River. River has an array of services such as veterans-focused education, a vestibular disorder clinic, and now non-pharmaceutical treatments for pain, anxiety, and depression. Check them out on Facebook or on the web at riverofchange.org. Lastly, we'd like to show our appreciation to all of our veterans. Thank you for serving our country and keeping it safe.